Hi everybody. This is going to be our first audio PowerPoint for Communications 135. I did this for a couple of classes last semester and it seemed to work pretty well. The students seemed to enjoy it, though I did do it on Collaborate and tape them on Collaborate as opposed to YouTube. So I'm not sure how it's going to go on YouTube, but we shall see how it goes. So this is going to be topic 1.1, communication styles. I have included in your on your Moodle page the PowerPoints that go with this. I'm not going to cover every PowerPoint. I'm just going to hit the key ones in this presentation. So we may as well get started. So what is communication? Well, communication is a combination of verbal and nonverbal behaviors integrated for a purpose of sharing information. And it involves a successful transfer of a message and meanings, because it could have something different, right? From one person or group to another. So definition of communication, there are 5 steps. So number 1, sender has an idea. Then sender encodes his message, sends his message, the receiver decodes the message, and he understands and sends feedback to the sender. Now, any break in this chain, and you could have your message that doesn't get received. So it's really important that these 5 things go on. And there's so many things going around that it can interrupt this message. So roles and responsibility of the sender. Sender is responsible for encoding and sending their message, putting the message into a verbal or non-verbal symbols that receiver can understand. So if you're dealing with somebody who doesn't speak your language, you have to make sure that the message you're sending can at least be understood by them. Senders often express messages according to their own thoughts, agenda, needs, or feelings. And you really have to be clued into who you're dealing with on the other end to make sure they are able to receive your message. Roles and responsibilities of the receiver. So they're responsible for receiving the message and decoding it. They filter the message through their own prior knowledge on the subject and their own level of understanding. So you got to make sure that your message that you're sending, they're able to understand it. So it has to be in a language that they're going to be able to understand and at a level. So you're not going to talk medical jargon to somebody who's grade 5-ish. They filter the message through cultural and social background, as well as age and gender can affect how they hear the message. Remember, it's also it's obviously your responsibility to ensure that they understand exactly what you wanted them to understand. So there's 2 communication models, a linear model and a circular transactional model. The linear model is straight. I'm the receiver, I'm sending you a message, I'm the sender, I'm sending you a message, and you're going to receive it. No talking. It's just me to you. Not a very good way to send a message, especially if you're going to try and do some teaching. No verification of understanding, so you don't know if they actually got the message that you meant to send. Circular transactional model expands upon the linear model to include the context of the communication, feedback, and validation. So you're going to make sure that what you wanted the receiver to hear, he actually heard or she actually heard, and she's going to validate to you that she got the message. A much more effective model of communication. So why do we communicate? Well, command, entertain, persuade, explain, problem solve, inform. There's a number of reasons why we communicate with each other. It's the only way we can get our message across, right? So therapeutic communication, which is what this course is about, is specifically to the healthcare field. This refers to interaction between yourself, other members of the healthcare team, the patient, their families, and support systems. All of those pieces are integral pieces of the puzzle and all need to be taken into account when you're communicating. Meta communication. You're going to see this word quite a bit in this course. So just think of meta. If you have a meta complex, it's all encompassing. It just involves everything. So basically, meta communication includes both the verbal and nonverbal component of communication. So anything that has to do with communication is involved in meta communication. Then we have nonverbal versus verbal types of communication. And you should be familiar with both of these terms. So nonverbal communication, gestures, touching. Now remember, if you're going to touch somebody and it's not in an emergency situation, make sure you ask permission. Not everybody likes to be touched or hugged. And it can be very much a cultural thing. Hand holding, again. Sometimes you want to do it instinctively, but make sure that it's all right with the person that you're going to hold their hand. A gaze, a posture. Be engaging with your posture. Don't be standoffish. Be in tune. Face them right on. Get down to their level. Space. Now, some cultures have a space around them. You got to know that. Don't invade their space unless you have permission. And unless, of course, it's an emergency situation. Facial expressions and written communication. Now, if your verbal message doesn't match your nonverbal message, like if they're incongruent, your message will not be believed. Your nonverbal behavior must match your verbal behavior in order for your client or patient to actually believe you. So it's very important that you're not just giving lip service to patients. Now, is silence a form of communication? You betcha. Silence is actually very, very important and very effective form of communication. It allows the person you're speaking to actually have time to form their response, and gives them time, and it lets them know that you have the time to let them speak and get their thoughts organized. Now, verbal communication can change based on the pitch of our voice, the tone of our voice. Tone indicates feelings, attitudes, so you can be very expressive, spontaneous, uninhibited, or directive, which are authoritative and judgmental. Now, that's great in an emergency situation when you want somebody's attention, but you're certainly not going to do that in a situation where you're trying to comfort somebody. And problem solving. All of these are great for client communication. Pauses, so paralinguist features of the voice where the speaker does not produce words. You just wait and give the receiver some time to think. Again, it lets the receiver know that you have time. You're not rushing them. And volume, whether the voice is loud or soft. And again, there's a time and a place for volume. So just make sure you know that. Now, is there a difference between how genders communicate? Well, theories and evidence in research say there's not really a huge difference. There's no scientific evidence, just traditional findings. However, women tend to avoid conflict. We're more effective. We have more effective nonverbal skills. Women are more sincere, warmer, more person-centered. Now, again, this is just, normal, traditional. There are certainly people or men that are very sincere, very warm. And again, as for the men, they're direct, aggressive, task-oriented. And there are definitely women who actually fill that bill as well. So you can't paint everybody with the same brush. But on a typical basis, women tend to be a little bit more warmer and men a little bit more direct. Now, culture and communication, we are going to talk about more in Unit 3. So just be aware that there are differences in communication. So some signals and signs mean something in one culture, however, mean something totally different in another culture. So you just need to be aware of that. Interpersonal competence, buzzword. So it's when the healthcare provider understands the complex cognitive, behavioral, and cultural factors that influence communication. If someone has interpersonal competence, they are able to assess a situation and take into account the feelings of the people they're dealing with, and make sure their communication skills and their communication strategies match the situation that they're in. So you're not going to be like a bull in a china shop if you're dealing with a situation where a child has just died. You're going to take that into consideration, and you're going to use effective communication skills. And that's all interpersonal competence is. It's adjusting your social interaction based on the interaction you're having and being able to read people's reactions. So it's really, really important. This course hopes to make you more aware of your communication abilities and increase your interpersonal competence. That's the goal of this course. So hopefully that will happen. Now, I apologize for the brief Unit 1.1, but it covers the major points in this unit. And I hope you find it helpful.